Talk Radio. It's good to have your company this Saturday morning. The phone lines, of course, they're open for you. I want to hear from you on this because 12 to 15-year-olds back in the news again. It's time for us to have the conversation again. The government believes there is a strong case, they say, for offering COVID jabs to healthy 12 to 15-year-olds, according to a source talking to the BBC. They're awaiting advice from the UK's chief medical officers. On Friday, vaccine experts did not recommend the rollout as the benefits on health grounds alone were marginal. This puts the whole debate back in your focus. So, as a parent, will you support the vaccination of your child? Or do you think the government is getting this wrong and they should not be pushing this through? 0344 499 1000 is my telephone number. We'll be turning our attention to the discussions because if you have a look at the front page of today's Daily Telegraph, child jabs rollout to be pushed through. Similar story on the front page of today's Times newspaper. Children set to be jabbed from early next week. Let's get some medical input here. Dr. Bharat Pankania is a senior clinical lecturer at the University of Exeter Medical School, joins me now. Doctor, good morning to you. Thank you for joining us here on Talk Radio. Look, let's just take an understanding here. The JCVI won't approve it. The government still wants to push this through. Should we be vaccinating 12 to 15-year-olds?
In my expert opinion, an emphatic yes. And on this matter, I feel the Joint Committee on Vaccines and Immunization have got it wrong. If you look into the totality of the situation, meaning you immunize and what are the outcomes, there are many benefits. The benefits are to the pupil, to the school, to the community, to the suppression of infections. And of course, the great unknown and the great big worry is what happens when people get infected and go on to develop long COVID. So I feel on this matter, the JCVI have got it wrong. And if we look at previous advice from the JCVI on things like seasonal influenza vaccine, we do that. And we've been doing that for years. Same with Rubella, same with HPV vaccines.
Okay, I understand that, but you're telling me you're an expert. JCVI will tell us that they're the experts. The government will, I don't know, be doing whatever they think is politically correct. It's not surprising then that the public are now confused, because the public will say to you, the young are the least likely to be affected by COVID in a dangerous way. And they are also concerned about the health impacts that the older you get, the stats seem to indicate, and I'm no medical expert, this is my understanding. The older you get, the risks from COVID increase. And the compelling case for having vaccination is stronger. And I get that and I understand it. Not everybody agrees with me, but that's kind of my understanding of it. However, for the young, there are very few, if any, cases of people having died from COVID. Whilst we understand that there's long COVID there, the risks from having vaccination, whether it's an enlarged heart or whether it's blood clots or various other things that we've been told are concerns, increase in comparison to the risk to them of COVID. So how on earth do we understand that?
I know, and it is so unfortunate. And throughout this pandemic, the mixed messages from our government has been legendary. And this is not at all surprising. They have got form on getting it wrong and getting the messages wrong. On the subject, and I must tackle this, of myocarditis, which means inflammation of the heart tissues. If you were to get COVID, i.e. the infection from the wild virus, your chances of getting a more severe form of heart muscle inflammation are much greater compared to the very small chance of getting heart muscle inflammation with full recovery through the vaccines route. So this one about myocarditis and vaccines, and therefore it's a risk factor, is infinitely small. And it isn't a relevant factor when you compare it to the real infections.
Okay, let me understand then, what is who is the risk of not being vaccinated towards, if you like, because I don't see and I don't understand if there is any particular benefit for the youngsters who are being vaccinated on the basis that if they were to catch COVID, whilst there are some cases perhaps of long COVID, there aren't many, are there?
Well, no. It's a great unknown, and we don't know who will have long COVID. So if we have 3, 4, 5, 6, 7% of people who get an infection then go on to develop long COVID, 3, 4, 5, 6, 7%, that range of a large number is a large number of people with long COVID with an uncertain expectation, months, years, or forever. So it is something to be taken seriously. And the analogy here is seasonal influenza. It's exactly the same, but yet we do immunize our children with seasonal influenza every year, and that is to
Well, you say we
protect
do,
them.
but okay, so whose choice should it be as to who gets vaccinated? Should the parents have the ultimate sanction? So, for example, if these vaccines are made available, should it be the parent that decides whether or not their child is vaccinated?
Yes, and I have always, having been in this business for 30 years, I have never gone down the route of coercion. It is a voluntary thing, and my job as a public health expert is to, and I used to be a GP, I used to be pediatrics as well, all those arenas. My job was to advise, to inform, to educate, and to allay any fears, but they made the decision, and I feel,
Okay.
of course, the parents decide.
Okay, so now on the, I suppose, the rollout, the government said that there wouldn't be vaccine passports, but now there are for domestic use. I understand their implementation and use internationally for lots of different reasons. Do you support the use of the vaccine passport to go to, for example, whether it's nightclubs or venues or theatres or cinemas?
I'm ambivalent about it and I have my concerns. So let me express my concerns about it, which is because I deal with outbreaks, James, every day, and I know the real cold face operations. So you introduce a vaccine passport. What happens is I have a piece of paper and all my other guards of are you infected, are you infectious, they all drop. So it almost is a ruse to drop your guard because the guard is as follows. You may be fully immunized. You may be infected. Have you been tested? Have you got any signs and symptoms? All of that assessment takes time and effort, and failure to do that equals I'm going to give you a piece of paper which says you're fully immunized, you've got the all clear. Those are my concerns.
Right. Do you think we should be preparing, if you like, for further lockdowns? Would you support a further lockdown later in the year, or do you think that we've got to learn to live with this thing and avoid such things because of perhaps the parallel health problems that you have either by stopping people going to work or school, or indeed locking down the nation again and the huge financial cost?
No, I don't think we're going to have lockdowns with the current variants in circulation, etc. We can't predict the future, meaning if a nasty piece of work variant were to emerge and it's bypassing all the vaccines and it's a new game show. In that case, it is a new situation. But under the current situation where we've got over 80% of the adult population now fully immunized, we don't see the deaths. We are seeing the cases, but not the deaths. So I don't think we will have a lockdown. But another reason for having a resilient population and business continuity in schools, colleges, universities is to immunize. And that's another reason for saying we ought to immunize across the age groups to have a protected population.
What about the rollout? Because as far as I'm concerned, if we don't have a rollout of boosters for those, again, who want to have them, but those who have been vaccinated, I'm assuming that the whole vaccination program will be a waste of time and money. I don't understand why the government seems to be prioritizing 12 to 15-year-olds when, in fact, we should be looking at the population that's already been vaccinated to make sure that their vaccines are perhaps the most effective that they can be.
Let me lance that ball for you, James. So with respect to boosters, the evidence is not at all robust. And to quote my colleagues at World Health Organization, it is akin to giving a life jacket to somebody who's already got one. So with respect to boosters, it is not a urgency. It is not robust evidence that it is needed. On the other hand, the completely unimmunized people need some protection and prevention because prevention Prevention is a lot cheaper than ending up at a GP surgery or in hospital. Furthermore, it is also our duty to suppress infections in other parts of the world. Otherwise, a variant will arise and put us back.
There are a lot of people listening right now who might be very hesitant about having their children vaccinated. And if I were to have children, I would be very hesitant about it because I don't think that one can dismiss the JCVI, even if they are wrong. And I would look for categoric evidence in order to make sure that I was taking the right decision. Would that make me an anti-vaxxer? Am I wrong? How do you win that battle on the basis that there will be uncertainty up and down the country? And I would, in this particular point, I think that, you know, to be vaccinated as an older person, to me, it's a no-brainer, and I'm fully in support of it. I am yet to be convinced that younger people should be vaccinated because I can't understand the evidence. It's not being presented in a way that makes good sense to me. And I think that's the problem around the country, isn't it?
Unfortunately, it may be, but in the short time that we've got available, I would say the following. The United States, Canada, European Union, New Zealand are all got eminent scientists, eminent public health experts. They are all immunizing their 12 to 15-year-olds. Furthermore, the evidence of protection from a vaccine is much greater than the chance of getting the wild infection and you don't know the outcome. It is not a case of you will be okay. If you can protect, why don't you protect yourselves?
I can understand that. Just finally to you, Doctor, as we think about this battle that's clearly going to take place, because it's front page news again, with children, with discussion, how on earth can parents get the information to allow them to have that free choice that you say is so important?
Yeah, and I can see that, and I have been thinking about this because, there are a lot of parents who are now understandably worried and concerned, and it is up to our own Department of Health and Social Care and the Royal Colleges of Pediatrics, the Royal Colleges of General Practitioners, to say it, and to say it succinctly, clearly, easily understood, the risks, the benefits, the harm, etc., and take the parents with them and address their concerns. It is up to those people to now step up and do the messaging in lieu of the DOH not having done it.
Dr. Bharat Pankhania, thank you very much indeed for joining us. You are Senior Clinical Lecturer at the University of Exeter Medical School. So look, it's clear. The doctor thinks that getting children...